to be surgical cricothyrotomy. For whatever reason, we cannot get a definitive airway in this patient, and this is going to be the last ditch effort to get some air into this patient that he needs. He is a far way away from a hospital, so what we're going to be doing is possibly putting a nasal cannula in him just to get something in. But we might be BVMing him. We're gonna get a suction out because this is a bloody process. The correct sized ET tube, I have a 6 for him because the cuff can reach his trachea, but we only need a small one. I have my scalpel here and alcohol wipe, and my BVM has a capnography attached to it. So while they try to BVM, or if they can, I'm going to be getting all this set up. We're going to be starting with getting this area set up with alcohol wipes. I'm going to throw that away, and then we're going to get our scalpel out. We're going to be looking in the sternal notch, creeping up until we find the cricoid membrane and our thyroid. So feeling in there, I'm going to start with a scalpel there, not going too far in, and then I'm going to go across, not too far. I might be able to keep that open like that. I'm going to have this ET tube lubed up. I'm going to take this out and insert, making sure to suction as much as possible. Put this in the sharps. I'm gonna put this in here for later use. So it's in there. We have made sure that this can work. Take that off. I'm going to attach a BVM, making sure we keep a hold of our tube, making sure we have equal chest rise and fall, listening to lung sounds, listening to epigastric sounds every 5 to 6 seconds, because this is an adult. We're going to be bagging him. And then while I have an ENT partner do this, I'm going to get my tube taper. I'm going to place it around him like so. Close it off. Making sure we would have seen where it is. It's at the 6.0. And it didn't move with me putting this tube taper on there. We're going to make sure we hold on to it as much as we can and keep bagging him. Listening for lung sounds again, no epigastric sounds again, in case there was a perforation in the back of the trachea, and watching for the O2 saturations. And test complete.